You've been dispatched to a 26-year-old female complaining of labour pains.
Okay, so before we enter the scene, we've got PPE on. Ryan's got his glasses, glove and boots, and I've just got my gloves and my boots on. Things to consider would be the temperature of the atmosphere that the room is, because it's ideal to have the baby birthed in a warm room. We might consider heating up the ambulance prior to entering the scene. Other checks such as dangers can be done whilst entering the scene. Cool. Ryan, do you feel happy with that? Cool. So upon entering the scene, we're noting any dangers that could be occurring, and also the lighting of the room. Some mothers like to be in the dark when birthing, so we'll make sure that there's adequate lighting, that there isn't any dangers or obstacles in the room, and that the mother's in a nice comfortable position. Hi there, what's your name?
I'm Maddie.
Right, and what do you think, what's the issue today?
I think I might be in labour.
You think you might be in labour?
Yeah.
How many weeks pregnant are you?
38 weeks pregnant.
You're 38 weeks. Has there been any issues with the pregnancy?
Not that I've been told.
Okay. Ryan, could you please get out the BBA and the neonate research kit? Yeah. And then afterwards perform some vitals on Maddie here. So Maddie, did you have your waters broke? Have they broken already?
Yes, I think so.
What time did they break?
I don't know what the time was, but it must have been like 3 hours ago.
3 hours ago, so maybe 1 o'clock?
Yeah.
Around lunchtime-ish?
Yeah, that sounds about right.
Okay, so I'm just going to note down that time because that is important information to give to the hospital or the midwife. And when you had your waters break, did you see a mucus plug?
Yeah, it was just before.
It was just before, okay. Did
Yeah.
you see the colour of your waters when they did break?
It just looked a little bit like pee.
Just looked a little bit like pee, so
Yeah.
a yellowish colour?
Yeah.
Okay, well that's good. And is this this is your first pregnancy?
Yeah.
Right, and you don't have any kids prior?
No.
No, so Maddie here would be G1P0. Okay, and have you had any sensation to push, or has it just been contractions
Just
lately?
contractions so far.
Okay. When you have your contractions, would will they be quite painful?
Yeah.
Yeah. Okay. Would you like any pain relief?
Yes, please.
Yes, please. Okay. So what we will consider giving you is methoxyflurane, and Ryan, could you just get that real quick and do a drug check? So methoxyflurane is an inhaled analgesic. You haven't seen this before, have you?
No.
No? You don't have malignant hypothermia?
Don't know what that is.
Fair enough. You haven't had this in the last week?
No.
No. And you don't have any issues with your kidneys?
No.
Okay, well, given that and the expiry date and the dosage seems to be in order, I'm quite happy to give that to you. So just breathe in and out of the green ending here.
This one?
And yes, and if you want a stronger dose, you can cover up the hole as your contractions come and go.
Cool.
Could you please get a set of vitals from Maddie, just as a baseline set? Just prioritize blood pressure. Oh, are you having a contraction?
Yeah.
Okay. Just tell me when that contraction stops, okay?
Okay, it's dying down a bit.
It's dying down a bit?
Yeah.
Okay, so I'm just going to note down the duration of that contraction and when it occurred. So when you had your contraction, did you have any pain radiating anywhere?
Just like my lower back a little bit.
Just your lower back,
Yeah.
okay. When you have your next contraction, would it be alright if I just had a look?
Yeah.
Okay. So when you have your next contraction, just let us know, and we'll just have a check to see if baby's alright.
Ooh.
You having a contraction?
Yeah.
Okay. I'm just going to have a pick, okay?
Okay.
Okay. So I'm noticing that there is just a little bit of crowning that's occurring.
Yeah.
Yep, as it's being
I
pushed
think
through.
I need a push.
You think you need a push? Okay,
Yeah.
just push down. Use the towel.
Okay.
Don't want to drop the baby.
No. Ow.
Supporting
Ow.
the head.
Ow.
Yep,
Ow.
just keep pushing. You're doing great.
Thanks.
Keep going.
Ow. Ow.
You're doing really well.
Thanks. Ooh.
Awesome, very good. So I'm just going to be stimulating the baby's chest and back, and I'm going to be wiping any mucus off from the baby while supporting its neck. So I'm going to be doing an Apgar score. The baby's appearance is pink centrally, blue peripherally, which is quite normal when they first come out. The baby is grimacing a little bit on the stimulation and clearance of the airways. Can I get you to get me the stethoscope just to check its pulse real quick? And it is moving around, and it's not crying a lot, but it is passing air, which would indicate that the airway is clear. So just have a quick check of its pulse, which is definitely over 100 beats per minute. So I'm going to prioritize giving the baby skin-to-skin contact with mum. So in a few minutes, you might feel the need to push again.
Mm-hmm.
Have you had any pictures or imaging taken for your birthing?
Like ultrasounds?
Yeah, ultrasounds, seen your doctor, seen your midwife.
Yeah.
Yeah. Have you called your midwife?
Yeah, midwife's on her way. She's just stuck in traffic, maybe.
Okay.
I don't know.
And what about your partner, boyfriend,
he's at work.
husband? Okay, yeah, fair. When you had the imaging taken for your baby, it's just the one baby, not twins or anything?
Yeah,
okay. So on your next, you might feel the sensation to push in a few minutes or a few moments time. And that will just be you delivering your placenta.
Okay.
Brian, could you get another set of vitals just from mum? So I'm going to note down that the Apgar score, pink centrally, blue peripherally, that would be a 1, but heart rate over 100 beats per minute is 2. Movement wasn't, it was only sort of spontaneous on stimulation, and the grimace was the same, and there was no vigorous crying. So I'd go with a first Apgar of 6 or so, which I'm just going to note down. How's that methoxy feeling? Are you feeling
yeah,
less
I'm
pain?
not in a lot of pain at all right now.
Okay, good.
But I think I need to push again.
You think you need to push again? So we're just going to have another look and just see how that placenta's coming along.
Oh, there she is.
So when the placenta's being delivered, it's important not to pull or tug on the cord at all, and that's just so that you don't damage the placenta or the placenta doesn't get stuck or anything like that.
Oh, okay, just coming.
Okay, so the placenta's been birthed, and we're just going to examine it and make sure that it is all there in its entirety, checking both front and back. And it seems to be all there in one piece. So once the placentas stop pulsating, we're going to clamp it 15 centimetres from the baby, 10 centimetres from the placenta, and we're going to cut it. Now, I don't suppose you had any plans for who would cut the placenta?
Well, Dad, but he's at work, so.
So you don't mind if Ryan here?
No, that's all good.
No, okay. So Ryan, if you would, please. Right. So again, we'd make sure that the placenta stop pulsating before we would clamp and cut it. And we'll put it in this biohazard bag and make sure that we label that for the hospital and the maternity ward when we get there. So because your midwife isn't here and neither is your husband, we could wait for them, or we could transport you to the nearest birthing centre or the hospital. What would you like to do?
I don't mind, but I think my midwife's only a few minutes away now, hopefully.
So we might wait around, and so long as there wasn't any prominent bleeding from Maddie's vagina, or there wasn't any substantial concerns to make about her vital signs, I would feel quite comfortable waiting for the midwife to show up. However, we would also weigh that against delays and things like that, because it is quite important after a birth to be seen by a specialist. So now that the child's been born and the midwife is on the way, A couple of things also need to be done. So now that the child's been born, we now have two patients, the mum and the child. So it's important that we document the time of birth, we do a second Apgar score, and we continue to monitor the mum and the child for any improvement or deterioration within their condition. And once we're happy that things are moving towards the better, the child's Apgar score is 10 out of 10, the mother doesn't seem to have any decline within her condition, we'll congratulate her and we'll accommodate her every whim. Get her something to eat, get her something to drink, just make her comfortable until the midwife arrives, and then we can have a bit more of an in-depth discussion.